Dr. Naidu is a colorectal research fellow who's pursuing a Masters of Philosophy with the University of Sydney and the Concord Institute of Academic Surgery. During his postgraduate training, he developed a strong interest in the surgical sciences, particularly around the impact of basic and clinical science research on our surgical outcomes and quality of surgery assessment. So if we could play his presentation, it would be fabulous.
Good morning, ladies and gentlemen. My name is Krisanth Naidu, and thank you for this opportunity. The assessment of quality of colorectal cancer surgery focuses on two considerations. One, the plane of excision, and two, the extent of lymphadenectomy. The plane of excision is well established in the treatment of rectal cancer through TME, as you all know, and this is extended to the practice of complete mesocolic excision, CME, for colon cancer surgery. Both TME and CME share the same foundation. The twin consideration has received very little attention, and I believe this is mainly because of the challenges in objectively measuring the extent of it, which so far has only been limited to rudimentary assessment of lymph node harvest. CVL, as a counterpart to CME, has recently gained interest and has been seen as a way to broaden the quality of colorectal cancer surgery, and its application is understandably controversial. Accepting the extent of lymphadenectomy as a marker for surgical quality begs the question of how this will be assessed. As you can appreciate, when CBL specimens are considered, there's a greater distance from the tumor to the ligation of the supplying vessels. And also, ex vivo assessment does not provide an insight into unresected lymph nodes. Therefore, to make an inference on the unresected lymph nodes, one can look at residual arterial pedicles. Therefore, the aim of the study is to primarily assess the role of measuring residual arterial pedicles following resection of primary colorectal cancer and as a potential marker for quality of surgery as dictated by disease recurrence. Secondarily, we aim to investigate whether tissue morphometric measurements reliably correlate with the in vivo measurements of residual pedicles. The methodology of this prospective observational study encompasses three elements. Consecutive patients who underwent either a right hemi or an anterior resection for colon or rectal cancer between 2009 and 2019 were identified from a prospectively managed database that's been in existence since 1971. In addition to routine variables already captured, two new variable sets are prospectively measured. One being tissue morphometry, as you see here, TMA, TMB, TMC, and TMD, and the other being post-operative CT imaging. With regards to arterial pedicle assessments, CT images for colorectal cancer surveillance is used. From these images, data sets of mesenteric vasculature are reconstructed into 3D formats, and as seen here, IMA pedicles that terminate in clips and staple lines are measured using Singer viewer. Furthermore, the ileocolic pedicles are measured in a similar format. Overall, 262 patients were included for the study period. When the primary outcome measure is considered, the 5-year failure rate is 19.1% with a colonic preponderance. When standard clinical pathological variables were considered, there was a near equal preponderance of stage 2 and 3 disease. Interestingly, the number of lymph nodes between the anterior resection and right hemi groups was similar. Reflecting on the clinical pathological variables of interest, the mean arterial pedicle length resected was 30 millimeters, and importantly, the CVL rate was only 3.82. With regard to the primary outcome association stratified to arterial pedicle lengths, this slide shows pedicle length association to systemic recurrence stratified to various groups, particularly pedicle lengths. And this clearly shows that there's no association between various stratified pedicle lengths and systemic recurrence. Nevertheless, when other primary outcome associations were looked into, this study corroborated important clinical pathological variables such as tumor stage, lymphovascular invasion, perineural invasion, with a significant association with systemic. Secondary analysis showed no association between pedicle lengths and tissue morphometric markers or measurements, TMA, TMB, TMC, and TMD. I would like to bring your attention to TMA measurements. And not only is this showing an insignificant result, it does not reflect a biologically plausible result given the positive gradient. We read with interest this recently published study that confirmed pedicle length measured using routine CT scans provides clinicians with a valuable tool for measuring the extent of vascular ligation in their population being anti-resection patients who were only assessed with fixed specimens. Of note, this was in a population of routine CVL ligationers, and critically, those with a pedicle length of less than a centimeter, their 5-year survival was markedly improved compared to those with more than 1 centimeter pedicles. I would also like to note that the absence of studies, to our knowledge, regarding tissue morphometry indices as a surrogate marker for pedicle length measurements is significant. In conclusion, the results of the study included right hemicolectomies and anti-resections in a population of patients where CVL is not routinely practiced, and it is unable to demonstrate with this study a significant association between pedicle length and systemic recurrence. What is important to note as well, I think, is the results of these findings, I think, question the benefits of CVL as an all or nothing phenomena, as we have not been able to demonstrate a linear relationship with respect to pedicle length in a cohort of non-CVL patients. I'd like to acknowledge the Concord Radiology and Pathology Department. Thank you.
Excellent. Thank you, Krisanth, for that presentation. Is there anyone on the chat line that would like to ask any questions? Or Krisanth, would you yourself like to add anything further?
Apologies, I was muted. I think this is a very novel study as we're conducting it, and I think there's a lot of room for progression. And I look forward to doing more. I think there is a question.
Yeah. So was there an association with the pedicle length and the positive apical nodes and the outcome in those with node positive disease?
That was not assessed as part of the study, but that is a important note to consider for future undertaking.
Excellent. All right. Well,